Hi, I'm Emma B. I'm going to be a senior at the Overlake School this coming year, and I'm here today to talk to you all about depression rates in various populations with sexually transmitted infections. So, I came to this internship with a lot of really big questions. I wanted to know what the psychological effects are of being diagnosed with a chronic condition and how that may vary in people waiting for a cure versus those who simply accept this diagnosis. It was very hard to find conditions and studies that would help answer these big questions, but after scouring PubMed, I came to STIs. So, sexually transmitted infections, more commonly referred to as STIs, are infections caused by bacteria, viruses, or microorganisms. They are transmitted via bodily fluid, primarily during sexual interaction. This is a very prevalent issue in the United States and the world. According to the CDC in 2018, around 20% of the US population had an STI on any given day. So, that's a huge chunk of our population. STIs are good for my questions because they have these categories of curable and incurable. There is a little bit of gray area. For example, hepatitis B has both chronic and temporary versions. However, for the most part, they're quite clear cut categories. So, my objective was to compare the rate of depression in a population infected with a curable STI with that of an incurable STI. In order to do this, I did a literature review on PubMed and Web of Science. Relevant search terms for that included depression and depression rates, STI, STD, syphilis, gonorrhea, chlamydia, trichomoniasis, HBV or herpes, HPV, HIV, and AIDS, as well as their unabbreviated names. So, these are some of the studies that I found during my research. As you can see, they are all studies having to do with depression rates in various STI populations. I found as many studies as I could because I wanted to make sure that the populations being studied in each of the two studies I did were as similar as possible to control for as many variables as possible, and that ended up being the two studies highlighted in red over here. So with these two studies, I compared depression rates in as they had curable and incurable STIs studied, and I identified possible causes of similarities or differences in these depression rates. Here are the studies. We have infection with Trichomonas vaginalis increases the risk of psychiatric disorders in women, a nationwide population based cohort study, and depressive and anxiety disorders in women with HIV infection. So, trichomoniasis is an STI transmitted by a parasite. There are 276 million cases reported annually worldwide. So, that is a huge number. Symptoms show up primarily in women, which is why this study was done on women. Symptoms include abnormal vaginal discharge, swelling or itching around the vaginal opening, and pain when urinating. Men also have some of these symptoms occasionally, such as the pain when urinating. However, typically men don't have symptoms and don't even know that they are carriers of this disease. With the HIV study over here, that is human immunodeficiency virus, which is a virus that attacks the immune system. So, in the background here, no, that is not COVID 19, that is actually an HIV virus. 39 million people were living with HIV at the end of 2022 worldwide, and HIV has flu like symptoms and sometimes no symptoms at all. So many people can go very long periods of times, years even, without knowing that they have HIV, which is why regularly screening is so important to prevent transmission of HIV accidentally. Both of these STIs are transmitted through bodily fluids, primarily during sexual activity, but rarely, or more rarely, can be transmitted through other means, such as sharing of needles or from mother to child. So here's the first study, the one on trichomoniasis. All data was taken from Taiwan's national health insurance, which covers 99% of the population, and the study included patients who were newly diagnosed with trichomoniasis from January 1st of 2000 to December 31st of 2013. The study excluded those with prior trichomoniasis diagnoses, prior psychiatric disorders, those below 18 years of age, and anyone who was not female. The study had 9,373 trichomoniasis positive women and 37,492 trichomoniasis negative women. So the depressive rates are showed on the right here. In those trichomoniasis positive, there was a 3.96% rate of depression, and in those negative, there was a 2.17 rate of depression. The p-value for this was less than 0.001, which, if you don't know, means there is a less than 0.1% chance that these differences in depression rates are due to chance. Typically, a p-value of 0.05 or less is considered statistically significant. So in this case, there is a very high chance of statistical, or a very low chance that these numbers are due to chance. This is the HIV study I used, depressive and anxiety disorders in women with HIV infection. This was a longitudinal cohort study. The population was patients of groups such as clinics and organizations providing HIV care in North Central Florida. The study excluded those who don't speak English, those with a significant chronic illness or injury, history of a severe psychological disorder, those pregnant or nursing, and those with current substance abuse or dependence. The study also exclusively had those who were female between the ages of 18 and 70. Now, there were 93 HIV positive women in the study and 62 HIV negative women in this study. The depression rates are shown here. There was a 19.4% rate of depression in women HIV positive and a 4.8% rate in those HIV negative. They also took information on the 17-item Hamilton Depression Scale scores. So the Hamilton Depression Scale is a questionnaire to, I guess, quantify the severity of depressive symptoms in patients. So among HIV positive women, there is an average score of 8.7, while with the HIV negative women, there is an average score of 3.3. And as you can see, for the p-values in both of these studies, both were shown to be statistically significant. So here are my conclusions. Both studies showed statistical differences in depression rates between infected and non-infected populations. In trichomoniasis, the infected population had around double the depression rate compared to the control group, and in HIV, the infected population had a depression rate around quadruple the control group. Possible reasons for this include social stigma, health stress, and loss of quality of life. Those with STIs have to navigate a lot of health issues and attempt to get treatment whenever possible. There is an indication that there could be potentially higher rates of depression in HIV positive women than trichomoniasis positive women. However, due to certain limitations, that's not a definitive conclusion. I'll get more into that later. But a possible reason that HIV positive women might have higher rates of depression than trichomoniasis positive women may be due to the incurable nature of HIV, as well as the symptoms that include becoming immunocompromised and different severities of the struggles that I've listed before. So there are several limitations to this study. These include the fact that the studies are not the same. They have different patient locations. One was in Taiwan and one was in North Central Florida. They also have very different study sizes. The trichomoniasis study had thousands of women involved versus the HIV study had only around 90 HIV positive women included. There was also the HIV study excluded those with existing substance abuse problems, while the trichomoniasis study didn't. And if you notice, the control groups for each study had different depression rates in those even. So for the trichomoniasis study, there was a control depression rate of around 2% versus the HIV study had a control depression rate of around 5%. And that's likely due to a lot of things, especially because these two studies had women from Taiwan versus Florida. Trichomoniasis and HIV also have differences other than curability. So while I was trying to look into the effects that curability has on depression rates, it's undeniable that the struggles that HIV patients versus trichomoniasis patients have are different in many ways. So considering I had 3 weeks to do the study, this is a good step towards answering those big questions that I mentioned in the beginning. However, there's still definitely a lot of work that needs to be done. So these are some areas that I'm interested in seeing further research. More research needs to be done on depression rates in different STI populations to further understand the challenges that patients are facing and provide the best and most holistic healthcare possible. As healthcare providers, the goal is to provide patients with the with help in whatever way possible. And it's important to know that patients might need mental health support along with any STI treatment they may be receiving to provide the highest quality of care. Though prevention wasn't the focus in my study, in doing research, I did come across many studies that looked into the significance of depression in increasing sexually risky behavior, leading to the question of cause and effect. Are the higher rates of depression found in infected populations due to getting the STI, or are people getting STIs due to sexually risky behavior related to existing depression? This is another area where research is lacking, and hopefully in future years, there will be more research done on it. These are my references. And I would like to thank SSF, Dr. Pierre, and my co-interns. I had a lot of fun in this program. I especially enjoy the cadaver lab, and I'm very proud of my sutures over there. So I had an amazing time with all of you this week, and thank you for having me.
Thanks for that great presentation. Any questions from the audience? I'll tell Dr. Tan to save hers for the last. I lost it. Let me check online as well. We don't have any questions from the audience, so yeah, feel free to, anyone jump in? Oh, state your name and. We didn't get that online yet. What's your name again?
Yes, my name's Farzeen Rashid, and I'm one of the parents here. I've been so impressed with all your talks. This was such an articulate representation of the two studies. So thank you for that. I did want to ask you. I thought it was really interesting where you were kind of talking about both kind of talking about prevention, and I think in medicine there's a lot about trying to cure. I think as was alluded to, but there's also the aspect of the physical side of and symptoms there, as well as the mental health and the mental illness side. So it's great that you're kind of doing that study. Is this an area that you want to go deeper into around kind of mental health, depression, kind of and looking into that area?
Yeah, especially with chronic illnesses and that idea, right, of like curability versus like management, I am definitely very interested in it. And there's a lot of different areas that I can look into that. I started with looking into vision loss because I thought that would be an interesting way to do, but there just like wasn't enough research for me to do a presentation on it. But yeah, it's definitely a topic that I'm interested in. Yeah.
Great. Thank you.
Dr. Tan? This is great. She's helping me out.
Well, I wanted to thank you for reminding us that we need to provide whole person care. So oftentimes, mental health may be overlooked when we are uh, thinking about the medical conditions and especially chronic medical conditions. My question for you is, you think there's a role, or are you interested in looking into access to care, healthcare discrepancy in different populations?
Yeah, no, I'm very interested in that. Actually, Anna, when she was talking to us about taking a patient's history, really emphasized the importance of social determinants of healthcare, and that's something that I've learned a little bit about previously, but this program really emphasized for me. There's so many different ways that healthcare is determined outside of even access to a hospital, like access to healthy living environments and all stuff like that. I'm definitely very interested in looking to that further. And having met some of the physicians that have come in, some of them talked about things like on one side being a physician and also being an advocate or looking into health policy. And I think that's something that I want to look into more as I kind of decide what path I'm going to go on with my future.
Excellent. Thank you so much, Emma.